Let's talk a little bit about things like socioeconomic status too. What are some of the differences in birth outcome that you see that seem to play along socioeconomic status trends?
Of course, I think that's a wonderful question, and it's a very hard question to actually answer effectively and accurately. Everybody has their own sort of preconceptions, everybody has their own ideas about what actually impacts labor outcomes. Socioeconomic status is actually a really large driver of that for multiple reasons. One, it makes it more difficult to access care.
Mhm.
And most of the time during prenatal care, it's a long battery of screening tests meant to detect things before they actually become very large problems. If we're missing our prenatal appointments, that means that there's no opportunity to screen. And oftentimes these issues get worse and worse over time. And by the time you can't kind of actually catch it at the time of giving birth, it's oftentimes too late to do anything about it. You just have to do your best to mitigate those circumstances. So, when it comes to things like nutrition, that's driven by socioeconomic status very strongly, a very strong correlation between the two. And that has a very, very large effect when it comes to your birth outcome. When it comes to things like obesity, those tend to be correlated to socioeconomic status as well. And to be able to address that at its very root, it takes a much deeper look at a patient's life than we actually have time to go into during a 5 to 10 minute discussion at your prenatal appointment. So there's a lot more that needs to be done when it comes to addressing these different drivers of health. And I'm excited because I think we're paying a lot more attention to it as well.